All right. Good morning, everyone. It's such a pleasure to be here, and thank you for joining us for this session. All right. So, I think we were all really inspired by the stories from the caregivers that we just heard. There's a lot of unmet needs in LGS and a lot of things that we can be doing right now to improve the patient experience. And I was very inspired yesterday by the sessions that really framed what we can do right now to make things better. But what we wanted to make sure that we didn't lose sight of in this session is to kind of keep our eye on some of the longer term goals, some of the things that we need to start and the things that we need to keep on working on right now to make sure that we are really moving forward in a progressive manner and having a sense of what we could maybe do not today, not tomorrow, but hopefully in the very near future. And for me, some of the things that have come to my mind that are really important. Number one, trying to understand what we can actually do for disease-modifying therapeutics rather than just symptomatic therapeutics. And I mean this from the point of view of both the progression of seizures and, as we just heard, seizures coming back and being difficult to control, and also what can we do about neurodevelopmental outcomes in the long term. So how do we understand where we are right now and where we could go with that in the future? And the second point that I think merits some focus is comprehensive therapeutics. So a lot of our treatments, as we've been hearing, are of course focused on seizures, which is appropriate because it's a main issue for our patients and for our families. But also, we want to be able to think about, are there therapeutics that could be more of a all-in-one deal? So for instance, could we treat the seizures while treating cognitive and behavioral symptoms at the same time? Or could we have separate therapeutics that target cognition, behavior, sleep, all of the other comorbidities that really adversely affect quality of life? And so these are some of the things that I think that we're going to be able to focus on in this session. And so I'm just going to frame things a little bit for you in terms of what we were thinking when we were planning this session. So what do we need to really move forward on those points? So we need an improved biological understanding. So if we could start to understand why and how LGS develops, I think this would help us to focus on the most relevant therapeutics. And I would agree, I would argue that when we're thinking about biomarkers, we really need to understand what we mean by that and determine their relationship to the disease process. So are our biomarkers actually driving dysfunction? As in, if we were to target those markers and eliminate them, would we see improvements in disease outcomes? Or are they the passengers? As in, are they along for the ride, alerting us to the presence of a disease state or a risk for disease progression, but not actually functioning as effective therapeutic targets in and of themselves? And I think here what's going to help us is fundamental investigation using animal models, using genetics and our genetic markers, better understanding etiologies and the neural networks that are contributing to dysfunction. And our speakers are going to give you a sense of each of these as we go through the program, where we're at and hopefully where we're going as well. And next, I would actually suggest that to facilitate translation from some of these more basic principles and in vitro work into clinical applicability, we actually need to be able to think about how we can perturb our systems and monitor responses rather than just having a purely observational approach. And some of our speakers, myself included, are going to address how neuromodulation is a means by which we can transiently alter neural activity patterns. And I think this can actually provide us insight into this, how the system can be monitored, modified acutely and chronically. And lastly, we really need a solid clinical as well as a research foundation for these beyond seizure therapeutics. So some of our speakers are going to focus in on the key assessments and diagnostics that are going to shape our understanding of LGS comorbidities and identify for us where are the opportunities for new treatment and what these could look like. So overall, that's what we're going to try and get through this morning, and I'm excited for our speaker lineup. And with that, I'm going to give it over to our first speaker to open up the session. Thank you so much.